5 years ago, Yumi Look and Matt Day started a plant shop to help people with their mental wellness. That eventually turned into a local thriving brick and mortar business in the Rockridge area of Oakland. This year, expecting the new welcome change in their world of their daughter, brought another surprise, the discovery of cancer in Yumi's lung.
So I delivered my baby Mika on April 30th of this year, so just about 5 months ago. And I had a fairly long labor, a really short and sweet delivery, but immediately upon delivery, my placenta did not fully detach from my uterus, and so there was a bit of hemorrhaging with trying to get it removed. And we're not exactly sure, but we think that during the process of removal, I developed sepsis along the way, infection of the blood. And I got sent to the ICU. And I guess there was a doctor who had ordered a CT scan because they were actually looking for pneumonia. The CT scan revealed that I had like 2 small nodules in my right lung.
After Yumi became stable and about to leave the hospital with her new bundle of joy, the doctor reassured her that the nodules could be benign and recommending a follow-up a few months later, leaving Yumi to think that it's not a big deal and normal.
So 3 months later, July 31st, is when I got my second CT scan, a follow-up. And I remember I got it done on like a Thursday or Friday. It was like the end of the week. And then the following Monday, just a few days later, I get a call from a pulmonologist. And he says, hey, just letting you know that we found the nodules again. They're still there. Good news is that they look stable. They haven't grown in size. But this could be a type of cancer based on the ground glass like edging that they have, the shape of them. And so it went pretty quickly from telling me, we found these and they're still there, to they're cancerous and we have to talk about some options. And so it was just a few months ago that I found out that I have early stage adenocarcinoma, which is a type of glandular cancer in my right lung. Also, I think it hit my husband in a way where he lost his mother to cancer about in 2018, so 7 years ago. And for me, again, just thinking of the word and the associations with it and a lot of loss, I immediately thought of my daughter, and I think I kind of fast forwarded to visions of not being here for her, and that took a lot out of us. That day was a heavy day. It felt like a very, very heavy day.
Yumi's doctors led her to understand more about non-smoker lung cancer, specifically how it applies to Asian and Asian American women.
So I think traditionally when you think of lung cancer, you think of causes due to tobacco use and like chronic smoking. But from what I understand and what I've been told, there's been this growing number of Asian females, non-smokers, who have been getting diagnosed with this adenocarcinoma. From what I understand, screening for lung cancer is not common if you're a non-smoker.
Lori Satoda, a Japanese-American research scientist and epidemiologist with Kaiser Permanente, has been studying this issue.
Unfortunately, we don't know why the incidence is higher among never smoking Asian American individuals, particularly women, compared to women who have never smoked of other racial and ethnic groups. We're involved in a study called FANS. FAN stands for Female Asian Never Smoker, and it's a study that is designed to identify risk factors for lung cancer, specifically among Asian American women who have never smoked.
Dr. Satoda is hopeful that the FAN study can someday lead to early detection screening.
By identifying risk factors for lung cancer among those who have never smoked, we can identify a subset of the population who is at higher risk for developing this disease and could be recommended to undergo screening in the future. But currently, we do not have enough data to support screening for individuals who have never smoked?
My thoracic surgeon, Dr. Velota, guesses that I've probably had it for the past 10, 15 years. Again, that's a guess, but perhaps it's that slow growing that's just been in me and just kind of hanging out right now. And he was saying that had it not been for the incidental finding, we might have found it maybe in the next 10, 15 years, 20 years from now, and at a later stage, of course. But I'm completely asymptomatic. I really would not have known had it not been for kind of the random occurrence at the hospital.
We wish Yumi good luck and hope Dr. Sakoda's research leads to early detection to help at-risk non-smoking Asian American women in the future. This is Greg Gloria for Alec Yoshio McDonald for the Nichi Bei Cafe.